And so you said your preceptor was out for a vacation or something, and then you decided to take the peek behind the curtain and
Yes.
started learning more about pelvic health and things like that.
Yep.
So speaking about that, what all do you actually do, and what is all encompassed in that being a pelvic
Yeah.
physical therapist?
Yeah. So, and there's kind of a distinction, like I kind of mentioned before, between a women's health physical therapist, a pelvic health physical therapist. There's men's health physical therapist. So you can get even within these sub niches within what you want to do. But for pelvic health, we basically, I kind of joke with people, like I specialize in treating between the diaphragm and the pelvic floor, like diaphragm and the knees. Anything within that area, like that is my domain. That's typically an area that most other PTs are not super comfortable talking about or working in that area. They haven't had the training in PT school. We maybe had like a lecture or two on pelvic health. Um, but within pelvic health, we treat anything that falls under the umbrella of pelvic floor disorders. So that can be bladder dysfunction, bowel dysfunction, sexual dysfunction, abdominal and pelvic pain. So some of the more common diagnoses that I see are incontinence or leakage, constipation, difficulty emptying the bladder or bowel completely, pelvic pain, and that is a very broad term for any type of pain within the pelvic area. So that can include like coccyx or tailbone pain, so like pain with sitting down, rectal pain, pain with bowel movements, pain with sexual activity, pain with pelvic exams, anything like that we can work on. We also work with people during and after pregnancy. And for PTs that do that, they may be a pelvic health PT or they may be a women's health PT where they may not even do any internal work with women or with people who've gone through pregnancy. So there is a little bit of a distinction with that. But those are the typical diagnoses that I'll see. But in terms of like treatment and evaluation, what really sets us apart from other PTs is that we do vaginal and rectal examinations and treatment. So that's typically training after PT school. We don't learn how to do that in PT school. So we have, different courses. It's usually like 3 or 4 courses that you'll go through for like the whole certification process. And we're actually practicing on each other, which is very, very different from other medical professions. And when I tell people that that's how we learn, they're like, you do what? Like you practice on each other? Because usually, in med school or PA school, they have models come in, um, med students or, students who need an extra couple bucks for, helping with people learning how to do these exams. But with PT, I mean, we're in a class of like 30 to 40 people, and we are literally learning how to do examinations and treatment on each other, which I think is helpful because we understand what we're doing to patients. And
Yeah,
it's not just like, oh, okay, well, we're going to do this, and I've never had it done to myself.
yeah, yeah.
So I think that's something that's really unique and kind of cool, in my opinion, for pelvic PTs for our training.
All right, great, great.